Child Impact International is an organization that gives hope and fosters permanent, positive change in the lives of disadvantaged children and their communities. Countries include Zambia, India, Nepal, Bangladesh, Sri Lanka, and Myanmar. Child Impact's investment in the lives of more than 3,500 children continues to yield infinite returns. Outreach spans from child rescue operations to providing an education and a home for deaf and blind children and orphans. Above all, Child Impact's sponsors give hope to the ones who need it the most.
Hi, I'm Jim Rennie, CEO of Child Impact International, and I just want to talk to you about India. And as you know, and as you've seen on the news, the pandemic is going to huge proportions beyond the capabilities of the country to cope with it. Hospitals are full, people are sitting on the streets outside hospitals, there's no oxygen, and to be honest, it's very, very serious and a huge disaster, and it's only getting worse. I just want to talk for a minute about our sponsorship program in India. Obviously, with the schools being closed, some had just started to open when this wave of the pandemic hit again. So the schools are closed. And for our sponsors who are contributing to children, this puts us in a dilemma. Well, we are continuing to pay the schools the sponsorship money for the very reason that they don't have the bulk of their income, and the teachers are not being paid, and these schools are being put in a very vulnerable financial position. So we want to support the teachers as best as we can, and we are distributing rice to them, but we also want to ensure that the schools open. So we believe our ongoing support has an important role keeping the Adventist mission schools open. As you know, we operate in this emergency our rice, health and education appeal, and we're getting many requests from all over India for help to these hospitals and medical clinics, and it's simply overcoming and not a business that we're normally in. However, we have received a special request through Anita Kanaiya, who is our director of our rescue team in Bangalore, India. And so we want to interview Anita and consider the help that we could give. I'm interviewing Anita Kanaiya, who's our director of our rescue operation in Bangalore, India. But right now, India is facing a pandemic crisis. And I know you've all seen the pictures on television, and it's actually unbelievable. So we just want to briefly talk to Anita and find out what's going on the ground, because Child Impact and its supporters have been asked to step in and just help in a small way to save some lives in the city of Bangalore. So Anita, it's great to see you.
Thank you, Jim. Thank you for the concern that you have for India, and thank you for this invitation to be on this call.
So just give us a short overview of the situation. Is it really as bad as we're being told?
Yes, it is, and it's probably worse than you are being told. The country is reeling under the second wave of COVID infection that has, gone beyond anybody's expectations, medical facilities and doctors especially. Just the sheer numbers that are present in India, and this virus that has become so virulent and is easily jumping from person to person. We have just about every family who's either been affected, lost somebody, or is battling with friends who are really serious. So this is just across India. There's no particular place that is really able to say that we're safe. There are particular states and cities in India which are very bad. There are some others who are all right, but Bengaluru or Bangalore, where we are located, is particularly very, very bad.
And just tell me about the impact on the people that are in the poverty situation, the people that we would normally be helping with food, the poor. What impact? Just tell me some of the effects that it's having on the poor. For instance, you told me about the orphans yesterday.
So Jim, what happened, and I have been added to a government group of people who run homes, who are experts with children, basically to discuss how do we look after children who have either been orphaned because both parents have succumbed to COVID, or who are left alone at home without carers because both parents are in hospital. There have been so many kids, names. There are people who have brought children who are COVID positive and have left them in public places. So someone will care for them because there's no one to look after them. Neighbors are scared. People don't want to do that, but by God's grace, I think people have come forward, families have come forward, institutions have ramped up. Childcare institutions have ramped up to look after children, but we're talking about large numbers of children, because this particular wave has hit the younger people. So between those in their 40s and their 30s have actually succumbed to the disease very fast and have left very young children homeless.
Right, that's just amazing. So let's, we don't have much time, so let's just talk about so you've been put on this group, a Christian group of those involved and also involving the government. So tell us about the request that we've received from the Baptist Hospital.
So I'm part of a group of Christians who are looking to see how we can respond to this COVID crisis, whether it is to help with oxygen or to help with actual admissions, because there are no beds and we get about 200 phone calls a day. We've got volunteers working round the clock to try and access beds in hospitals for the very serious. We started food distribution about 3 weeks ago for those who've been home quarantined, and there are lots of elderly people, husbands and wives whose children are abroad, who've got COVID and they just don't have any help. So we're supplying food to more than 210 families of say 4 or 6 who are just shut off from the outside world. What this disease does is it isolates you. People don't want to come. You are forced to be in a home quarantine. You can't get access to food. So that's one of the responses we have been doing over the last 3 weeks. But the medical response, Baptist Hospital is one of the premier Christian mission hospitals in Bangalore, and a lot of us actually access our medical care from there. And though that hospital has been completely flooded with requests and have turned away ambulances with very serious people because they don't have beds. So one of the requests that came from them was if we could help them with a ventilator, they could increase the capacity of beds to look after some very serious people. The other requests are from another mission hospital called the Marthoma Mission Hospital, which has just ramped up an entire floor of beds, and they needed some medical equipment to help them to deal with these cases. We ourselves have actually sent pastors and Christian people as referrals to these both these hospitals, and they have recovered. So we are really looking to see how we can help them in this time of need to ramp up their medical facility to be able to treat more people, especially Christians who are struggling, and the poor.
Well, we're very excited that today we're sending you the money for the ventilator and the supportive equipment. Just very quickly, can you assure us that the money will get to the right people and that the ventilator will get to the hospital.
So let me assure you that this is us, that is me in this group. I have known these, it's a group of doctors, medical suppliers. I'm in direct contact with the medical supplier of the equipment. In fact, this morning I spoke to him and he reassured me that he has supplies, because people are running out of supplies at this time. So yes, I am in direct contact, Jim. The money will be paid directly to the vendor, and we have already gotten to an agreement of how the payment will go through and how the machines will be delivered. I am in touch with the Baptist Hospital. We have got letters from them, and which we will send on to you, where they have assured us that these equipments will be used immediately, put to use immediately. So please rest assured that this money that you are raising, thank you so much for it at this time of need, will go towards the equipment directly to the vendor and to the hospital. And I will personally make sure that we actually have evidence that the machines have reached and they are in use, and that we can send on. So please rest assured that we are following up as closely as possible to ensure that the machines are reaching exactly where they need to be to help people.
Anita, that's just amazing, and we are so excited that we can support. And I know that the people who are watching this who support Child Impact International and have in fact supported Operation Child Rescue, because Anita is responsible for the rescues in Bangalore and also the Azadi home that I know many of you have supported. This emergency is overwhelming. This emergency is beyond comprehension. And I just ask that if you wish to contribute to this emergency, please go to the child website, and we're putting it through the Food, Health and Education Emergency Appeal, and you'll be able to see it on our website. Anita, we appreciate what you're doing, and our prayers are with you in the work that you do. And we're very proud and excited that we can assist you on the ground in Bangalore, India. Child Impact is proud of the work that you and your team do. Thank you.
Thank you very much, Jim, and thank you to all the donors and supporters who, who have a heart for India. And thank you for just meeting our need at this very critical time. Thank you so much.
Well, you've heard from Anita the situation on the ground in Bangalore, and in fact it's the same all over India. And I guess it's a little hard for us to comprehend, but we've seen it on the news. And as we've received this special request from our Christian brothers, we believe that we need to help. And as you know, we operate the Rice Health and Education Appeal. And so for this month, any funds that come in, we're going to allocate to help these Christian doctors and hospitals with oxygen equipment or beds or anything they urgently need. Now, I really appreciate the generosity you've shown already for this appeal. And I guess we're not normally in the emergency field, but we just have a responsibility to help. And I know you want to help. And so I just ask you to consider supporting the Child Impact Rice Health and Education Appeal. You can go to our website, childimpact.org, and you'll see the Rice Health and Education Appeal featured there. And I would just want to thank you for the support you've given and the support you will give as we look at this tragic situation in India.